More than a dozen European countries have suspended the rollout of Astrazeneca's COVID vaccine. This is due to blood clot concerns. We want to talk about this with Dr. Hlatshwayo Davis, infectious disease physician at Washington University School of Medicine and the John Cochrane VA Medical Center. And doctor, it's great to have you back on Yahoo Finance. Put this into context for us. How serious are these side effects when we talk about the number of people who have experienced blood clots? Because we've heard a number of health officials come out over the last couple of days arguing that the benefits of the vaccine still outweigh that risk.
So this has become a source of major concern, but I think it's so important to contextualize this and understand that in reviewing the data, myself and many other people in the medical and public health arena have seen that the number and the proportion with which this is happening is no higher than what you see in the general public. So there's quite frankly not a concerning signal here. And this appears to be more politically motivated than anything to do with the actual science.
Hi, Doctor. Can't imagine politics ever interfering with science. But since we're talking science, we're now testing one of the vaccines, the Moderna vaccine, in children. When they do these kinds of tests, I mean, someone who's ignorant about this, there's absolutely no threat to children from the vaccine or from adults because the vaccine itself is dead. Is that an accurate way to describe it?
That is an accurate way. Listen, we have a lot of vaccines in development. Some of them will have the dead vaccine, but the ones that we're talking about specifically right now with Moderna is part of the mRNA technology that was developed by folks like Dr. Kazmika Corbett at the NIH and her colleagues. So there's no virus being introduced into the body. You know, we've done a phenomenal job here. A year ago, I would have never, ever thought that we would have a vaccine for COVID. And the phase 3 clinical trials that have happened for multiple of these vaccines have been overwhelmingly positive, really high efficacy, and relatively safe, really great safety profile. So it's absolutely appropriate that we are now moving these trials into children. Recently, we did the same with pregnant women. This is exactly what we need to see to get towards herd immunity and protect as many of our loved ones as possible.
Doctor, when we talk about getting more and more people vaccinated, people obviously have to be comfortable. They have to be confident in the vaccines. When you see what's happening to AstraZeneca, how does a company, how does that brand overcome the damage that's been done by 13 European countries suspending the use of it for now?
It's a big hurdle. You know, I'm not going to downplay it. It's so unfortunate that this has happened. AstraZeneca is one of the most important distributors that we have, and that may not seem as significant in the US, where we obviously have been leaning heavily towards Pfizer, Moderna, and Johnson & Johnson. But understand that globally, vaccine distribution is not as robust as what we are privileged enough to experience here. So those countries have actually really relied heavily on having AstraZeneca and even other vaccine products at their disposal. So overcoming this hesitation, this fear, this mistrust around this data is going to be critical. And I say to them what I've said for what we needed to do here within communities of color who had to overcome their own barriers because of valid mistrust from documented histories of abuse at the hands of government and public health institutions. And that is center the trusted messengers, center the people that folks lean to trust. And that is going to look different for different segments of the population. So you really have to diversify who the folks are that are talking about this information and make sure that they're disseminating in a way that is relatable and accessible to the general public.
Dr. Hlatshwayo Davis, we always appreciate you taking the time to join us here at Yahoo Finance. We look forward to having you back again soon. Thanks so much for joining us.